Welcome. In this video, we'll walk through key coding steps for cervical spine X-ray services, covering CPT codes, imaging views, and the proper way to code a chart using ICD-10-CM. Let's get started. Cervical spine imaging focuses on the neck region of the spine and includes multiple views depending on the clinical need. Let's review the CPT codes used to report this service. 72040, cervical spine, 2 or 3 views. This is appropriate for limited studies, often used in trauma, pain, or follow-up imaging. 72050, cervical spine, 4 or 5 views. This includes a more thorough exam of the neck with multiple angles, but does not yet qualify as a complete study. 72052, cervical spine, 6 or more views. This is the most comprehensive exam. It typically includes oblique projections, flexion, and extension views, or additional specialized angles to fully assess alignment, curvature, and injury. Here are the views often included in cervical spine studies. The number and type help determine the correct CPT, AP or PA view of the cervical spine, AP odontoid open mouth view, lateral flexion and extension views, oblique views right and left, swimmer's view for the cervicothoracic junction, AP Fuchs or PA Judd methods to evaluate the odontoid when standard open mouth is inadequate. Chart example, order exam, C-spine 2 or 3 views. Header, AP, lateral, and lateral swimmer's views of the cervical spine. History, Fusion 9 2022. Comparison, Radiograph 923-2022, CT 919-2022, MRI 919-2022. Findings, post-surgical changes of C4 corpectomy and interbody fusion with C3 through 6 anterior cervical plate and screw fixation with unchanged alignment. No evidence of hardware complication. Similar cervical spine degenerative changes. Impression, post-surgical changes of the C3 through C6 anterior cervical discectomy and fusion without evidence of complication. Let's look at the views. AP lateral and lateral swimmer's views. That's a total of 3 views. This qualifies for CPT code 72040, radiologic examination of the cervical spine, 2 or 3 views. This is a post-operative follow-up with no acute findings. The imaging is being done to assess the status of surgical hardware and spinal alignment. Avoid coding any incidental findings like degenerative changes unless the radiologist or provider states that these findings are clinically significant or the reason for the exam. The appropriate diagnosis code should reflect post-surgical status. M43.28, fusion of spine, cervical region, only use if the fusion itself is the primary focus of the visit or documented reason for continued follow-up. Z98.1, arthrodesis status for documentation of the fusion hardware. Chart example, postoperative cervical spine imaging order exam, cervical spine, 4 or 5 views. Header, AP, lateral swimmers, and flexion and extension views. History, post-op comparison, MRI from 11/13/2022, and prior X-rays from 10/14/2022. Findings, redemonstration of anterior spinal fusion from C6 to T1, corpectomy at C7, and posterior fusion hardware from C5 to T2. No signs of hardware complication or dynamic malalignment. Impression, stable postoperative changes, no significant change in alignment or hardware. Let's count the views documented in the header. AP, lateral swimmers, flexion, extension, that totals 5 views. This supports CPT code 72050, radiologic examination of the cervical spine, 4 or 5 views. This is a post-operative follow-up with no acute findings. The imaging is being done to assess the status of surgical hardware and spinal alignment. Avoid coding any incidental findings like degenerative disc disease or obscured anatomy unless the radiologist or provider states that these findings are clinically significant or the reason for the exam. The appropriate diagnosis code should reflect post-surgical status. The correct ICD-10 codes for this report are M43.28, fusion of spine, cervical region, only use if the fusion itself is the primary focus of the visit or documented reason for continued follow-up. Z98.1, arthrodesis status for the fusion hardware. Chart example order exam, C-spine, 6 or more views. History, pain, chronic, no injury, pain at neck and shoulder. Comparison, cervical MRI dated 1/28/2023. Technique, AP, right and left oblique, odontoid, open mouth, neutral lateral, flexion and extension lateral views. Findings: mild anterolisthesis at C3-4 and C4-5 worsens with flexion and improves with extension. Severe disc space narrowing at C5-6 and C6-7. Prominent end plate osteophytes and facet arthropathy at multiple levels. No acute fracture, neural foraminal narrowing at C5-6 and C6-7 bilaterally. Impression: moderate to severe cervical spondylosis. No acute findings. Dynamic instability not evident. This is not trauma-related, and the history clearly states chronic pain. Imaging was performed for ongoing symptoms, not injury or follow-up from an acute event. The findings support degenerative spine disease, also known as generalized cervical spondylosis. Based on this, appropriate diagnosis codes is M47.812, spondylosis without myelopathy or radiculopathy, cervical region. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.